Welcome to Tuesday Tips. What would it mean to you if you had 28 different resources at your fingertips to help your aging loved one and you as possibly their caregiver just have this vast variety of information at your fingertips that you can go back to and review. And maybe it might not be an issue now, but maybe 2, 3, 4, 5, 6 months from now, you would have wished that you would have had that information. Well, we have got you covered. I'm really, really super excited to share during this Tuesday Tips today about our upcoming Senior Care Summit. And so that's what we're going to do is we're going to review a little bit about this. What does it mean? How does it work? And what can it do for you? So let's go ahead and get into that. So what we are going to do is we're going to have 28 speakers on 28 different topics around senior care resources. Now we're going to have some healthcare speakers, health and wellness, and we're going to have some non-healthcare, but some supportive services. So for example, we're going to have a nurse practitioner, Tina Baxter. She's going to talk about depression, delirium, and dementia and what that looks like for our aging adults. We're going to have Dee Dee Bays. She's a CFP, a certified financial planner. She is going to share a presentation on financial planning for looking at what you want to do, planning regarding aging in place or whether or not you're going to live out your aging or your senior years in some kind of senior living. And so she's going to help you plan for that. We're going to look at hospice. What is hospice? What's all that about? We're going to have caregiver support presentations. We're going to talk about caregiver burnout. We're going to talk about self-care. We have an optometrist going to talk about eye care for seniors, as well as a billing patient health advocate who specializes in helping people manage their medical bills and get them reduced and make sure that they're not paying a penny more than what they're supposed to pay. A lot of times, your medical bills, there's mistakes. I mean, people, it's human beings behind it that are putting codes on and sometimes they make mistakes. So if you're dealing and struggling with some hefty medical bills, we've got some tips and strategies for you. We're also going to have a representative for one of our Wisconsin shelters for domestic violence and abuse, and they're going to talk about elder abuse. So we're going to have just a wide variety of things that you're going to be able to access. And how are we going to organize these? We're going to organize these presentations in 5 areas of need. The first area of need is going to be caregiving support and family dynamics. We talked a little bit about what that's going to look like. Area of need, or category 2, is going to be navigating the healthcare system. And we're going to talk about what that looks like. Area of need number 3, or category 3, will be the health and wellness. This is where you're going to see a lot of your healthcare professionals doing their presentations in this category. Then we're going to have area of need 4, or category 4, home and environment. This is where we're going to look at assisted living placement services, and we're going to cover a little bit more what's in those categories. And then the last category will be area of need 5, or category 5, legal and financial. So how does this work? So we're going to have 2 options available. We want to have this be as comprehensive as possible for all of our viewers. And so we're going to have 2 options available. We're going to have a free access option. Again, for those that want the free option, we're going to release 2 videos per day for the 14 days of the summit. The summit is going to run from March 1st to March 14th of 2024. And each day we will release 2 videos. So you will have a minimum of 24 hours to review the 2 videos. The videos are running on average 30 to 40 minutes, so they're not that long. And then the next day we will release 2 more videos. And at that time, the previous day's videos will no longer be accessible, but you will have a minimum of 24 hours to watch those 2 videos. So that you will not have anything less than everybody else is going to get, except you'll just have a limited amount of time to be able to view those videos, but you will get to have all 28 videos plus our 2 bonus videos that we're going to have for everyone. And that is going to be our welcome video. We'll talk a little bit about that in a minute, and our keynote speaker. So now if you want unlimited access, which means we're going to have the video stored in our Nurse Advocate Now hub, where you will have unlimited access to those for as long as we're in business. And if for some reason we're done and those videos aren't going to be available, we will let you know so that you have the option of downloading those videos. So you will have unlimited access for as long as you want them. And that's going to be $67. And that's a super bargain. This rate of $67 is going to be available until March 1st. And when the summit is released, and then it's going to go up to $99 after that. So make sure you get on the early bird special. We will talk about when the registration is going to be available. And the $67 covers all 5 areas of need, or all 28 videos. Now, if, for example, you don't want to see home and environment, or you don't want to see caregiving support, maybe you just want to see the health and wellness category. Well, the categories alone will be $14.97 each. You could purchase one or more, or the greatest value is to purchase all 28 for the $67. So we do want to make sure that we have all kinds of ways for everyone to be able to access. We are going to have registration up on our yournurseadvocateconsulting.com. That's our website, and we'll have more information on that in a minute. So who are we? We are your hosts. And for those of you that are watching live, Tuesday Tips is something that we broadcast live in our Speaking Out in the Care of Aging Parents forum, and that's our private Facebook group. Everybody is welcome to access that. And when you see this video, you will have access to be able to check out our forum. So those of you that are in our forum, you're seeing this live or going to see this recorded, you know how to get a hold of us, but we will put in the video description a way for you, for those of you that are just viewing this for the first time, to have the option of joining our forum, and also have the option of being able to register for our summit. So Linda and I, my name is Pam Dunwald. My partner is Linda Criticus. We are both registered nurses, and we are both board certified patient advocates. We've been patient advocates now for 3 years, and Linda and I both have over 40 years experience each as an RN, and we are senior care experts. This is what we've spent our career doing. So we help families put plans in place to meet the healthcare goals and the needs of their aging loved ones. So our services, we assist in life planning, such as advanced directives, choosing aging in place versus senior living, identifying needs, and then developing a plan with resources. And that's very common for us to do. So I think the best way to share what we do is to tell you a brief story about one of our clients that we've helped. So we had a gal give us a call. Her husband has Alzheimer's disease. He's weak. He's no longer able to leave the home. He's not farther enough in the stages of Alzheimer's to qualify for hospice at this time. So she's not able to get him out to the doctor. She wanted him to get a flu shot. She's essentially homebound by default because she's not able to get out and go grocery shopping or go out and do any social activities because she is unable to take him with her, and she's uncomfortable leaving him home alone. So what she did is the first thing that we tell everybody to do, and she did just that, is to go to your local aging and disability resource center, your aging center, your senior center, whatever it's called in your county. Every county in every state of the United States has one. And this is where all your senior resources are housed, and they have booklets, they have directories of the resources in your area. So this is always the place that we encourage people to start. And she had already done that prior to reaching out to us, but they were over assets. They were not able to get any free services, or the Aging and Disability Resource Center wasn't able to help them with their services. So they gave her a booklet of services in the community that she could call and reach out to. So she went out and essentially let her fingers do the walking and dialing numbers. We were only one of 2 companies that actually called her back within 24 hours. And so she explained her story to me. She said she was so desperate, and the desperation in her voice, I felt so bad for her. She says, "Can you help me? I don't know what to do or how to get these things. And she kept repeating over, the things that she needed because she just was so desperate. So what we did is we met with her. We again reviewed all the needs. We went to work to find put a plan in place. We got the health department in her county to come out and give him a flu shot. We found a palliative care agency that actually comes to the home. Some palliative cares, you have to go to them like you go to the doctor's office, but we found a palliative care service that would come to their home. We found a non-medical home care agency that would come and sit with him and spend time with him while she was able to go out and run errands and go to her own doctor's appointments. And then we also found an adult daycare in her area where if she wanted to leave him for an extended time during the day, and he would have socialization and things like that. So we put all of these plans in place. And then as these plans were being put into place, we have our Your Nurse Now monthly it's kind of a maintenance program where you can, there's a monthly fee. It's $99. It's very affordable. That keeps us in your back pocket. And if something were to go wrong or they were having issues with one of the services we were setting up, they would always have us available. So she stayed with us 3 months on our monthly plan. We also have a hub of resources that we have and checklists and Q&A sessions and guest speakers for people just in that that monthly maintenance or our Your Nurse Advocate Now program. So she stayed with us 3 months on that until everything was firmly established. Palliative care now took over, and they're going to manage his care. And she was very grateful that we were able to put this all together. So that gives you a good example of some of the things that Linda and I can do. So let's get back to the summit. So topics will include area of need 1, which would be caregiver support and family dynamics. We're having a mental health professional talk about caregiver burnout. We're having another mental health professional talk about self-care. We're having Catholic Charities talk about all the programs and all the services that they offer for both the aging adult to give them purpose and identity and keep them going and give them opportunities for volunteering, also to give respite and give support and services for the caring, the family that's providing the care. So lots of help there. Need 2 would be navigating the healthcare system. This is where we're going to talk about senior living placement services, what to look for when you're choosing one, hospice, what is non-medical home care and how do you get it, and more in that area. So need 3 would be health and wellness. This is where you're going to see, as I mentioned before, a lot of your mental health, your health and wellness or your healthcare professionals. We're going to have not only your mental health providers, but I just recorded the video with Dr. Kaylin Russ. What an amazing audiologist. She's a doctor that deals with hearing loss or an audiologist. I learned so much from her, and I think this is going to be really an eye-opening presentation for all of you to look at hearing loss and tinnitus, which is ringing in the ear or other noises that you hear. And I guarantee there is a wealth of information in that presentation. We're going to have a chiropractor, eye doctor. We're going to have a lot of information in this category. Need 4, which would be home and environment. So we're going to have a contractor actually come on and talk about how do you remodel or how do you modify a wet space or a bathroom to install all those safety devices that you need, and how do you do that properly? Are there codes? What's all the logistics that go into that? We're going to have a realtor talk about moving with seniors. We're going to have a downsizing and decluttering expert talk about what to do with seniors, especially when they have a lot of memorabilia, that they need to handle. So we're going to have help for you there. And then the last need or need 5 is going to be legal and financial. We're going to have a financial planning. We have Dee Dee Bays, who is a financial planner, as I mentioned before, is going to talk about how do you plan for either aging in place or living out your golden years in a senior living type setting. Estate planning, we talked about earlier that we're going to have Sam from Turning Point, which is a shelter in the state of Wisconsin here, and she is going to be talking on elder abuse. So we're going to have all of those things available in that area of need. So where are these all going to be? So for those of you that do purchase the unlimited access and do get the VIP access. This is what our Your Nurse Advocate Now hub is going to look like. You're going to see this big tab, this big block there, and it's going to be called Senior Summit 2024. And when you click on that, where it says click here, check here, that is going to bring you to it's going to be sorted in all the 5 area of needs. You'll click on the need, you'll have access to the ones that you've purchased. When you click on that area of need, it's going to open up all the videos and list all the videos that's in that category. There's going to be help tabs. Reach out if you have questions. There's going to be resources there. Also, there's going to be a link to our community if you'd like to have access to our speaking out on the care of your aging parents. All of that will be available from this hub, and those that purchase VIP access will have access to all of that. So basically, I'd like to, invite you to come join us. And, no matter where you live, these resources are going to be found in your area. We have speakers in over 9 states in the United States. And so everybody's presentation is geared toward general information. And so that you can take this information. And if you don't live in an area where the speaker might be, you may, at least now you know what to look for in your area. And again, whether you reach out to your resource center or whether you use an advocate like Linda or myself, we can also help find these resources that you need in your area. So this summit is going to pertain to anyone that lives anywhere here in the United States. So, what would it mean to you to have access to these videos? You go to a senior fair and you have all these booths and you go from booth to booth and you collect information and they share information. And then you go home and it's like, oh, I don't know what this was about, or I don't remember what this person did. Or you might hear, presentation, and then sometimes some people will take notes, sometimes you don't. But this is something that you would have and, have access to, that you can refer back to. And again, if it's not pertinent for you now, 2 months from now, one of these videos may be just what you need to be able to give you the information to seek out the resources that you have. So, and with the VIP access, if you look at a video and maybe you miss something and you go back a second time, or you review it with another family member or your aging loved one, you might find something that you missed the first time around. So it's just an extensive amount of information that we're very, very excited and happy to be able to share. We want to thank all of our speakers and our sponsors that have come together to help support us with this. This has been a huge and a tremendous undertaking, and everyone is just coming from a place of wanting to serve and help our seniors. So I hope you appreciate all the effort that's gone in, and the fact that we're doing this from a place of giving. And seniors are very special to all of us that are participating in this. So we hope that you gain everything that you need out of this. And, after the summit is over, if you think that there is something that we missed or left out, we're going to really appreciate any feedback that you give us on our speakers, and maybe, for next time, what we may be able to do better, or what other speakers you'd like to see. So registration is going to be available beginning February 1st, and you'll be able to register on our website, which is just yournurseadvocateconsulting.com. Mark your calendars. Again, the summit will run from March 1st to March 14th. We will also have, we will be sharing this and promoting this in all of our social media channels, and our speakers will be promoting, our sponsors will be sharing. So we will have links available as well as our website to be able to go ahead and get registered. So we look forward to serving you. We look forward to bringing you this information. We hope that you find it very valuable. And again, we hope to see you soon in the summit. And thanks for you that stopped by and caught us live. And we will see you soon for our next Tuesday Tips. Take care.